Hola, friends. Welcome to the Medicine, Marriage, and Money YouTube channel, the only channel for physicians who want to achieve marital interdependence and financial freedom together. On this channel, you will learn how to show up as the best version of yourself so that you can love intentionally and build a more financially savvy relationship with your spouse. And I am your host, a physician mom, a doctor's wife, a Gottman leader, a certified life and marriage coach, Dr. Kate Mangona. Welcome. Bienvenidos. Hello, sweet friends, and welcome to another episode of Medicine, Marriage, and Money. Please welcome Dr. Anne Truong, and I'm going to make sure I pronounce that correctly when after I introduce you. So Dr. Anne, she is an inspirational, motivational. She's a board certified physician, podcaster, YouTuber, entrepreneur of the year in 2018. She specializes in sexual health for men, although she does sexual health for everybody. So we have lots of questions for you, especially pertaining to relationships, marriage, non-marriage, everything as it pertains to everything. And of course, you are also a loving wife of 31 years to a husband and 2 children. So let's just go ahead and applause for Dr. Anne. Let me know, am I pronouncing your name correctly? And what else would you say to describe yourself?
Oh, I'm actually, first of all, a wife, a mother, and a physician, third, because my family comes first. Without them, I wouldn't be here. And that's why I love being on the show, because, my family, my husband are very important to me, even before my business as well, too. So without them, I wouldn't be here where I'm at this point. So I'm excited to share and talk about anything you want to talk about today.
Yeah. Okay. So first, I just want to go back 31 years. I start all my podcasts like this. I want to know how you fell in love. Why did you fall in love? What did that look like?
Oh, wow. So I met my husband at the beginning of 4th year in medical school. And it just is a very funny story. You'll enjoy this. So, 4th year medical school. That's when you start doing elective. That's when you decide where you're going to go for residency. The best year of your life, right? You just finished 3 years. You passed board part 1. You're like, yeah, I'm like a third way to being a doctor, and you're at sky high. So I met my husband because his parents are my long-term friends of my parents, but we never met. So we live at that time in California, in San Jose. So his parents came to visit me, and he came along because he'd never been to San Jose. And I don't live in San Jose. I was in med school in Nevada, and I happened to be visiting my parents that weekend. And that's how I met him. I was visiting my parents. I was in my 4th year. He happened to be there visiting my parents in San Jose, California. And we met, and my parents just said, you know what? He's here by himself. You just entertain him for a weekend, and, so that way he doesn't get bored or anything. So that's how we met. But at that time, he had a girlfriend. He actually was in another relationship and as well. But they were just starting to date. And so I met him that weekend. I said, this is a really nice guy. And I'm like, So I decided, you know what? I'm just going to throw my ticket in there. And even though he has a girlfriend, he's not married. He's not married. He has a girlfriend. It's up to him to choose. So what I did was, at that time, there's no cell phone. We had, the handheld phone, and I got his address, and I sent him cookie flowers. So they made flowers that are chocolate chip cookies. Yes. At that time, it was $60. And to me, as the poor med student with student loan, $60 was like $600,
Yes, yes. Oh my goodness.
So I sent him a bouquet of cookie flowers that arrived at his work, where his girlfriend saw it when it arrived, and of course, he had to dance around, make some excuses. But I threw my ticket in. I said, you know what? And see what happened. So it started out friendly, and we talked to each other on the phone. He called me and thank you, and then next thing lead to another. There's another phone call. There's another phone call, and then there's another phone call, and so we met in September, and by December, we knew that we were just talking on the phone, and we didn't see each other in person after that. But we knew that we wanted to continue the relationship, and so he came and visited me in January. That's when it officially became we're dating. We're seriously dating. But I wanted to say that when you meet somebody and you feel it's right, go for your instinct and do it. Yeah, I mean, I could have been rejected, but I'm like, well, he would, if that's the case, that's the case.
Yep.
It didn't really matter to me, but I knew that he was important enough for me to gamble
Yep.
that. And then, we met in September. We got married the following June. So we'd only dated 10 months. We only met 10 months and really dated maybe 5 months. About 5.5 months, and got married in June. But we did the legal service, in the court on June 5th of 1993. But then our reception was in December of 1993, because I was starting residency. I was starting
Wow.
my
Okay.
first year of internal medicine residency, and my parents didn't want us at that time, 1993. Now they didn't want us to live together until we were married.
Uh-huh.
And that's why we got legally married first with our family, only
Uh-huh.
just the families alone on June, and then had a reception on December of the following year. So
Wow. Okay.
that's how we met.
Well, that, yeah, and yeah, I mean, you would only be out $60, right? Flower cookie bouquet, but no, thank goodness, because look, 31 years later, and can you tell us what was the most difficult for the past 31 years? What has been the most difficult struggle you have had to go through together, and how did you get through it? Like, how did you grow together? Did you ever grow apart? Like, how did you get through?
Well, the most difficult part was the first year we were married, because
Okay.
how difficult can this be? And I know you know this, because your husband's also a doctor too. My husband is an engineer, and he was working as an engineer when we first got married. First year in residency as an intern, right? Got married, lived together for the first time. I've never lived with another person other than my roommate, another girlfriend, and move into a new city. I trained in Long Beach and UC Irvine at that time. So all new stuff at the same time. And plus, I was on call every third day. So that means every third day I sleep at the hospital. I don't go home. I come home 36 hours later, and then, fall asleep and work for another day, and then on call again. So at that time, there was no restriction to how many hours resident work, right? So we were working at least 120 hours a week at the least,
Wow.
and you would work 36-hour straight shift. So it was at that time. I was in ICU, and I was talking to him on the phone. No cell phones. I was using the ICU phone. And when you're in ICU, you have to sleep there. You're on call. You sleep in the ICU. And he called me up and he said, "I want a divorce."
The first year of marriage?
He said, "I want a divorce because I don't see you anymore. I hardly even know you. And when I do see you, you're exhausted. You're asleep. You're exhausted. And I did feel like, I don't see you, and I want to see you. I love you. I want to be with you." And so it was difficult, but I talked to my husband from not leaving me in ICU and in the ICU in my intern year, and I essentially told him, I said, "Let's not make any rash decisions right now, and I'll talk to you when I get home." But we were able to have an open and honest conversation about it, because I knew where he was coming from. I listened to him, and I put myself in his shoe. I get it. I can see how he feels. I didn't take it that he was attacking me in any way. And he was essentially, he told me, "I want to get divorced because I don't see you." I get it. He doesn't see me, but he didn't know what he was getting into either. You know,
Mhm.
he'd never married a doctor who's starting an intern year before, and we were
Yeah.
at that time 27 years old.
So,
You know,
Anne, what strategies did I know you said, you talked him through it at that time point, but so did anything change? Like, what did you change? I mean, you can't change a Q3 call schedule when you're a resident physician. So, how did it's a mindset? Some of this must have been right mindset or just like showing compassion, understanding. Like, what strategies did you put into place after he said, "I want a divorce"?
right. So what strategy was that we promised this to each other, that we love each other, and we promised that we love each other. We will be honest with one another. That was one thing. And then the second thing was that we're going to spend as much time together as we can. All
Mm.
right. When we do have time, and we're going to spend as much time together as we can. And then third was that he would go and spend time with me if I was on call, if I had some time to eat together. You
Mhm.
know, we would have dinner together, even briefly. Just seeing each other once a day. Even he said, I just need to see you in a 36-hour period. I said, well, that makes sense. You know, even though I was busy, I was still able to have half an hour dinner here and there. I mean, I had a beeper then, you know. And in certain rotation, he's able to stay late and hang out. You know, if I was in a rotation where it was not that busy, he can kind of hang out at, the lounge area as well.
Yeah.
So he came in and spent some time with me as well. So it was a period of adjustment and knowing that we wanted to spend time together, even at work. Because before that, I would be working 36 hours, not see him at all. And sometimes you're so busy, you don't have a cell phone, you can't even text, right?
Yep.
If you can talk to a landline, and I'm at the hospital, and the landline is where the nursing station is, you know? So I don't have a phone, I don't have a cell phone to say, hey, I love you, I'm thinking about you. You couldn't do that. But we made it work. But ultimately, before I got married, my parent tells me, you're not going to marry the perfect person. You're going to marry the person that will it's the best person for you, and you're going to have to work through the bump. You're going to have to work through the hard part, because marriage is like a job. You have to work at it, and the more you put into it, the more you get out of it.
Wow, what
Yeah.
wisdom from you are not going to marry the perfect person. You are going to marry the best person for you. Marriage is a job.
Yeah.
Oh my gosh, I love it. Okay, so fast forward, when did you become the sexual health expert for men? And what is that like? How did you do that? What does that look like?
Well, it was around 2014. So I had been doing. I'm a pain management doctor by board certification,
Okay.
and mainly in sports medicine. I was doing a lot of pain management through using your own stem cell, autologous stem cell. And in 2014, I went to a lecture, and this doctor were talking about putting your own stem cell in the genital area to rejuvenate the tissue, to
Mm.
restore men with erectile dysfunction again. I was like, oh my God, I've been putting, stem cell in your knee, your hip, and your spine. Why couldn't you put it in a sexual organ? It made perfect sense to me. And I just thought that it made so much sense. And the thing that I like about that was that it was 2014. I was already in practice for about almost 20 years at that
Mhm.
time, and I wanted to add different services to my practice.
Mhm.
So we started doing that. We started adding stem cell for restoration, for men with ED to restore function again. And we started seeing that change, but it was remarkable change. And one thing
Mhm.
about when you're dealing with sexual medicine is that you're not only fixing the man, you're fixing the relationship as well, too. So that's what I like about that, is that, yeah, I like the pain management. I still do that. But the sexual health part, sexual medicine part, is that yes, you're restoring a man with ED into functioning again, but us also strengthen his relationship. You're really kind of treating the woman as well in that relationship. And oftentimes I have many women come call me up and say, thank you. You have literally saved our marriage. Our marriage was on the brink of divorce. And because now that he's able to function again, we are now better connected physically and mentally as well. He's a different person. He's more confident. He's more open. He's more happy. He's just a pleasant person to be around. And, when men, their sexual functions an integral part of who they are. All right.
Mhm.
It reflects in their self-confidence, the way they carry themselves,
Mhm.
and everything else. But the one thing about that is that sexual health is really health, because the things that I recommend for sexual health, aside from the stem cell treatment, is really diet, exercise, sleep management, and stress reduction, which is the same thing you would recommend for somebody with heart disease, somebody
Right.
with high blood pressure or diabetes, right?
Yep.
So sexual health is all about blood flow, and it's all about anti-inflammation, about inflammation and treating inflammation. So those are the four pillars of sexual health, which is really health. So I find it fascinating. I find it just an area that interests me a lot, because I feel that I'm working with the physical part, but I'm also working with the relationship part, in your
Yes.
realm as well too, and that is gratifying to be with. But I still do pain management, but I keep my feet in there. But the main part is really sexual health for men. But we also treat women as well for
Okay.
sexual dysfunction.
Oh, so okay, talk a little bit about that. And so for two things, I see this book behind you right there.
Yeah,
Can you tell, is that your book?
that's my book. I wrote that book.
Yeah, when
It's
did you write
actually a
that book?
bestseller on Amazon, 2018.
2018, you wrote the book. We can find on Amazon, Erectile Dysfunction Fix.
Uh-huh.
Okay.
Yeah.
Okay. So tell us about women's sexual health too, and how does that come into play?
Well, this is very interesting. I research has shown that if a man has ED, a woman also has sexual dysfunction as well, too. That's right. She also, because she's not getting lubricated, right? They're not having physical relations, right? So she's not being lubricated. She's not having blood flow down there. So she's having dysfunction. Now, this is so interesting. I find it so fascinating. I didn't even know about it until I went to a conference that girls, when they're born, you don't have a labia minora. And
Mm-hmm.
when you have your menses, you start having the labia minora. But
Mm-hmm.
as women age and you're in menopause, and women start menopause around mid-40s, you actually have atrophy of the labia minora.
Mm.
These physical changes that happens in your vulva, like the labia minora get atrophy and literally shrink away, and the vulva, the labia majora also shrink,
Okay.
and the vaginal canal also shorten. It is there, and the rugae, which are the ridges in the vaginal canal, actually become flatter, and the structure become less. It's less elastic,
Okay.
and it's not as moist. So there is physical changes in her vulva, or the whole vaginal vault area, that actually can create discomfort for women.
Mm.
Yes, as they get older, particularly around, some women even notice it in their 30s, especially women that had hysterectomy. When you have a
Okay.
hysterectomy, you might as well be in menopause. Right? That's a surgical menopause. So women have these physical changes too, but then they don't know about that. They're living with it. Yeah, they're living with thinking, oh, that's just part of aging, but it can be easily corrected
Okay.
with hormonal with testosterone cream for arousal and for libido, and also with estrogen, estradiol, cream down there. Easily, I have seen women that describe to me that when they have intercourse, it feels like sandpaper. And yes, sandpaper,
Mhm.
that much discomfort, but they bear with it for years because they thought that was just part of getting older. And I said, and I want to hear all of your audience to know, men and women, no women should have painful intercourse. It can be easily fixed and treated within between 5 to 7 days with
Wow.
just a cream. Yeah, no
Okay,
women should endure that.
with the estrogen cream
And testosterone.
and testosterone.
Yep, testosterone cream compounded, or even testosterone gel. For the testosterone will help with the libido and the arousal,
Okay.
and estrogen cream or vaginal insert will help with the moisture and will help with getting more blood flow down there for a more responsive vulva. So that way it gets rid of the discomfort. It get rid
Okay.
of that feeling of feeling like sandpaper again.
Oh yeah, that no woman should have to ever feel like that, right? Like, I mean, how are you going to get aroused when you know it's going to feel like sound paper?
Yeah,
So,
absolutely.
what do you think about these clinics, Dr. Ann, that are popping up everywhere to get these little testosterone pellets put in you? Have you heard of that?
Of course, I do testosterone pellets.
Okay.
Yeah.
So, how do you feel? What is that? Is that because you mentioned testosterone gel?
Uh-huh.
No, these and you are a board certified physician. I've heard that these clinics are just popping up like without actually physicians doing them.
Yeah, no, I'm concerned about that because hormonal replacement therapy should be monitored by a physician that is specialized in hormonal therapy. This is not something that you can learn on an online course. All right,
Okay.
you have to. Yes, you go attend lectures and you learn it, but you have to been doing it for several years because you have to see the clinical presentation. But first of all, you have to get blood work. You have to get thorough blood work. You have to get thorough history.
Mhm.
The doctor have to get the thorough history from you to correlate your history along with your physical finding.
Mhm.
And sexual health is the biopsychosocial. It's bio, but it's psycho, but it's also social. It's relationship, it's psychology, and also the bio part. So and then you get thorough blood work. The blood worker has to look at not only the hormone, but it has to look at sex hormone binding globulin, thyroid hormone, even insulin, and even cortisol. All of that play a role because hormone is the balance. It's not a lot of the clinic that you mentioned, and I know what you're talking about. They just jack up the testosterone level as high up as they can to make people feel better. But what they don't know is that hormone is the balance. High doesn't necessarily mean good. Low, that's not good. It's a sweet spot, and everybody has a different sweet spot. So you go slow and you work up until you find that. Now we treat patients because of symptoms. Hormone management, you treat them from symptom improvement, not the blood level. So a
Okay.
lot of the clinics just base it upon the blood level, and they just raise it up as high as they can, and then the patient will feel like I don't feel better. They raise it up again. What they don't realize is that when hormones get on a high level, what happens? It gets converted to an inflammatory hormone, like testosterone gets converted to estrogen. Testosterone can be converted to another hormone called dihydrotestosterone, or DHT, which can cause hair loss and can also cause irritation to the prostate. When DHT is high, the prostate gets enlarged for a man. And then when DHT is high, you can have hair loss. And then a man, if his testosterone level is high, it gets converted to estrogen. Estrogen will make you have man boob, gynecomastia, and also will actually put more fat in the love handles area. And a lot of clinics just doesn't realize that jacking it up it's not better. Oftentimes I actually lower the dose and the man feel better. But it's a balance, because sometimes you have to balance also his thyroid. You have to look at his insulin level. And again, the four pillars of sexual health: diet, exercise, sleep, and stress management. Why stress management? Because if your stress is high, your cortisol level will be high, and then when the cortisol is up, it suppresses testosterone. It suppresses also insulin. So you got to control that stress, right? So that way the cortisol gets control, and then the sleep, because your body repairs sleep. When you sleep, your body repairs physically and mentally, and that's
Yeah.
how your hormones get made when you're sleeping, right?
Okay. So
Yeah,
you help your patients with the whole biopsychosocial aspects of it. Now, do you have anybody who helps you, or do you do all of it? Do you do the labs, the medication part, plus the mind, the psychoanalysis, or the psychology
no, no.
behind it, and the social?
Right. I don't do the psychology of that so much. If that's required, I usually send them to a sex therapist, but that's not that often. I just find that the reason why I mentioned biopsychosocial is that oftentimes if you optimize the physical part, the psychology improve. If it doesn't improve, then I will refer to sex therapist. So I don't have that in my office,
Okay.
but I stress lifestyle a lot.
Okay.
Lifestyle modifications such as diet and exercise. So in the office, it's really just me and my nurse who does a lot of the interaction with the patient.
Okay.
That's it. I believe in being lean, because I believe that the patient like to see me. We don't take insurance as well, so they get to spend time with me. And I do the hormone management, but I know exactly what you're talking about. It's a concern of mine too, because oftentimes I'll see patient coming in to see us that have been to another clinic who mismanaged his and her hormone replacement therapy, because a lot of people just don't take the time to really look at comprehensively what's going on with the patient. I would tell you, if a guy is like maybe early 40s, and if he changes diet and exercise, he can actually increase his testosterone level by around 100 to 200 level. Meaning if 300 is considered low, he can raise it up to 500, which will make him feel a lot better. So
Yeah.
oftentimes I will, if the guy's young, I would stress that to them as well too. See if they can raise it up and check the level again. And if he's
Mhm.
still low, then I'll supplement it with or the hormone replacement therapy. And for men, I actually do pellet of testosterone, because it has less side effects than injectables as well. The injectable has more side effects, and who wants to inject themselves once a week or twice a week?
Got it. Okay. Any other things you see in your office besides erectile dysfunction? Or is that like the main thing you treat, or are there other common things, or maybe not so common things, that men just don't even realize they have, or women don't even realize they need to be seen for?
Right. Well, 87% of men don't know that they have ED,
Okay.
because ED is just not total impotent. And that's not ED. ED could range from longer to get an erection, to getting erection and losing it, to even like delayed ejaculation or premature. That's all part of the spectrum of ED, and that oftentimes ED will present when you have what testosterone level drop, which is in their actually later 20s. Men drop 1 to 2% in their late 20s. And the testosterone is the first hormone that drop in women as well too. Testosterone is the first hormone that drop in women. And the reason why I mentioned that is because you don't know what you don't know, right? So men and women don't know that their hormones dropping. Maybe that's why they have a less libido. They're not aroused easily. They're not orgasming as easily as they used to. But then they blame themselves. They go, "Oh, maybe I'm busy with the kids, all this and that." and they blame themselves for it. But maybe there's your hormone is changing. But know that, and but maybe I should take a step back and look at my diet and what my exercise regimen is, and how's my sleep, and am I doing stuff to decrease my stress? Nowadays, stress levels is higher than it's ever been, right? With cell phone and doing multiple things at the same time, we just don't have time for de-stressing. So
Yeah.
so you asked me what else do I do in my offices. I mainly do sexual health. I still do pain management by doing autologous stem cell therapy or using platelet rich plasma at this point. But we also do hair loss. So when we help men with their sexual function, we also help them regrow a little bit of hair with hair regrowth with using their own stem cell, injecting it along the scalp to induce more hair growth. But again, that goes back to hormone management and balance,
Right.
and
Yeah.
also lifestyle.
And so what percentage of men and versus women do you see in your office?
Oh my goodness, probably 85% men,
Yeah.
and 15% women. And yeah, I would say 15% women. But I have to tell you, Kate, it's just that men, their sexual health is important to them. If they can't get an erection to perform in the bedroom, that's their priority. For women, I find that less women would initiate, come to see me and say, "Oh, I'm not having good orgasming right now. I don't have the libido." It's fewer than men. Let's just say
Yeah.
fewer than men, that women will make an appointment and say, "Oh, I have seen women come to see me and say, well, my orgasm's not as good as it was before, and
Yeah.
my libido is not as good." Yeah, I've seen them, but that is much less than a man.
Yeah. Now, do you
Maybe
see that
because,
changing?
yeah.
Yeah. Oh, yeah. What were you saying? Maybe because yeah. What do you
Oh well,
maybe
maybe,
because what?
I think maybe because it's also societal norms,
Yeah.
and a woman can take a passive role in an intimate relationship versus the man. You can't fake an erection. You don't have an erection. You don't have an erection.
Yes, you can't fake an erection, and also like just message: don't ever fake an orgasm, even if you're a woman, right? Like they can come see you for help too. And I think, I mean, have you noticed a change recently? I feel like I've seen more of a change when it comes to normalizing talking about sexual health amongst women and making it more of a normal topic. Whereas years ago, it was just kind of said like, oh, women are too complicated. It's just not even worth it.
Oh, absolutely. I definitely see that change in awareness. Awareness of sexual. It's no longer for women. No longer it's like, oh, you're a bad person or you're promiscuous if you talk about sex, or if you're interested in sex. It's almost like almost like, oh, and I guess it depends on where you are. I mean, where I'm at in the South, people still get embarrassed when talk about, sexuality. I'm not talking about like intimate, but just sexuality. They just get embarrassed. They don't want to talk about it. In
Mhm.
LA, probably not, right? In LA or in California, probably not. New York, probably not. Florida, probably not. So it depends on where you're at. But I think that the more women are empowered
Yeah.
to in themselves, and in their sexuality and in their life, their career, because you have to realize now women can have their own job. They don't need men to provide financial security,
Yep.
like in the 1950s, right, anymore, right? And that women, I mean, there are a lot of good sex toys out there. Honestly, right? And oftentimes, a woman does not need a man to fulfill that area. And
Yeah.
then you want to have a baby? Well, you can have in vitro fertilization. You have
There are
IVF.
a lot
So,
of options. Certainly, there are a lot of options. Um, the other question I wanted to ask you, focusing more on your marriage, is how has this business, because you have had tremendous growth, right? From when you started years ago, been developing your practice, writing your book. how did all of this journey, and especially because it's men's sexual health, how has this impacted your own marriage?
Oh, I think it helped me than anything else, honestly. It helped me be a better wife, be a better lover. And it helped me understand what men go through and understand physiology of sexual health. Oh my God, the more I understand about sexual health, the more I understand how to be better lover as a wife, and also teaching him as well too. Teaching
Mm,
him about, what area is erogenous and why that is. So he's open to it,
mhm.
he's open to learn because it really elevates our intimate experience. So if
Yes.
anything, and he knows what I do is work. I mean, I see men naked and so forth. It's work. It's like no different than a gynecologist, right? See, a gynecologist seeing female body parts, and it's a man, and he knows his work, and he encourages it. And sometimes he'll come in and take pictures or whatever. But if anything, it actually it help us in our intimate relationship
Yeah.
more, and that we're more aware of it. And both of us are on hormone replacement therapy. I'm on testosterone pellets as well as estrogen cream, and I take progesterone to help with my sleep
Mhm.
and mood. And my husband is on testosterone pellet, and I'm his doctor. I'm the one that does it for him. And so we're very active. And I tell my patient, do it 3 times a week. And I would look at him, I said, we're under par. And we're not at 3 times a week, then if we're not having sex 3 times a week, we're under par. So we need to surpass that. And so we have elevated our schedule now to 5 times a week. And if we don't meet that, then we try to make it up.
Wow. Okay. Okay. And this is so when you said, let's just back up a bit because you said he comes in and he takes pictures. Explain that a little bit more. I don't think the audience, you're seeing these naked men and then all of a sudden your husband pops in taking pictures.
Yeah,
What is that
well,
about?
right. Well, no. We wouldn't take the man, we wouldn't take a picture of the man, sexual organ, but it's really for social media. It's for social media where he'll take pictures, of me doing the procedure, but excluding the body part, so totally PG. It's really about letting people know what you do.
Oh, so he's your marketing. He's like helps you market. Okay.
Yes, yes. He comes in and he, help me market because if people don't know what you do, they can't find you, right? So
Yeah.
I'm very active on YouTube and on social media as well. And it's how we kind of talk about what we do. But we want to create a forum and a platform where men and women can talk about sexuality openly and not have to be embarrassed to say the word penis, not be embarrassed to say vagina. Why is that? Because it's an organ. It's an organ like our eyes, right? It's like an organ like our liver. It is an organ, but why is there this negative stigma about it just because we're
Yeah.
uncomfortable talking about it? But it's an organ.
Yep.
And like even saying the word clitoris, because the clitoris is the only organ that is purely for sexual pleasure. It has no other function than that. It doesn't do anything except to give a woman pleasure.
Yeah.
And yeah, it
I just,
really does.
the book I'm reading right now that I've been meaning to read for years, Come As You Are.
Yes, yes, yeah,
Yes. And she said
yeah.
exactly that. Yes. I mean, I don't even know if I remember learning that in med school. It might have been like hidden in the pages somewhere.
Yeah, but then you brought up a good point. My daughter's in med school right now, so I may have to suggest to their curriculum. Has anyone talked to you about sexual health before you get out of med school? You should have a talk. You should have somebody talk to you about sexual health. And I'm a clinical adjunct staff in her med school, so maybe I'll raise it up because I think that all doctors should have some awareness of sexual
Absolutely.
health.
Absolutely. Okay, so do you recommend to your patients to a certain amount of times to make love a week, or was that 3 to 5 elevation your number? I mean, what do you find?
Oh yeah, I tell patients that you don't use it, you lose it. All right, and I'm a big proponent of that, and for men and women, is that you can do it with a partner, you can do it solo, but get your sexual organ, going because it does atrophy. So for a man, his penis muscle actually atrophy if he doesn't get an erection, and especially if his testosterone level drop, because in the penis there are receptors for testosterone, which then after a man testosterone level decreases since starting in his 30s, 1 to 2% a year. So those receptors doesn't have enough testosterone attached to it, so it starts to atrophy. All
Okay.
right, so the muscle itself start to atrophy, and then the only way to really maintain the integrity and the flexibility of that muscle, the penis muscle, it's actually a smooth muscle, is to have an erection, and to have sexual activity, or by solo. It's, if you don't use it, you lose it. Same thing for a woman. A
Oh,
woman vulva, if if she doesn't have intercourse, or she doesn't masturbate, then she's not bringing blood flow there. She's not bringing blood flow there. Her testosterone level drop. The women start to drop around mid 30s. Her
uh-huh.
testosterone level start to drop, and then she's getting less blood flow. So again, she also has atrophy too. And
Right.
so you don't use it, you lose it, and that's why I recommend that they should have sexual activity at least 3 times a week. I don't care how old you are, the 30s, even up to 80s. You need to do it at least 3 times a week. Five optimal, but 3 times a week, because multiple studies have shown that you live longer, the more sex you have. You actually live longer, and you have better health, better longevity, better health, better cardiac health. You live longer if the more frequent sex you have, and that your heart is better. You're less depressed. Right, your immune system is better on your if you have more sexual health.
Mm,
You also burn calories, actually, because for a woman, she burns about 100 calories. For a man, ranging from 150 to 200, depends on
mhm,
how long that lasts, right?
mhm.
So it's an exercise, but it's a mood elevator. And you live longer, you have better heart, and also the more frequent sex you have, decrease a chance of less prostate cancer for men
Mm.
as well too. Yeah. So there are multiple benefits. In one of my podcasts, I talk about I think it was 10 benefits of sexual activity that we
Wow.
rarely think about. I mean, other than having orgasm and all of that. That's the part about it. But there are many health benefit to sexual activity. So, my motto to my patient is that make love and live longer and be happy.
I love it. Oh my gosh. Okay, make love, live longer, and be happy. Oh my gosh. I love this conversation, Anne. And could you tell us where to find you? And if we want to find some of these resources, like these research studies that have shown you live longer, you're happier, you're less depressed, it's better, you're less depressed, it's better for your longevity, where to find that as well?
Right. So the best thing is check me out on my YouTube channel.
Okay.
Is Truong Rehabilitation Center. It's my last name, Truong
Mhm.
Rehabilitation Center, or you can just type in my name, Dr. Ann Truong, Truong, and I'll pop up. And that's where I teach about sexual health for men, but there's a lot for women there as well, where I talk about all the benefits of sexual activity and about sexual health, and anything you want to know about sexual health, afraid to ask. But I teach it from a medical perspective. I teach it from the physical, the neural, the science perspective as well too, to make it so that you can understand, can actually have some actionable item for you to even do homework on. Because I feel that there's a lot of misinformation on the internet by people that are not credentialed to be able to talk about things like this. And sometimes they'll just sell you some snake oil or this supplement will get your erection back. getting your erection back is like it's like trying to reverse diabetes. It's multiple modality and it's complex. It's not just one thing,
Mhm.
to get your erection back, or one thing to get your orgasm. You got to work on the basic stuff. It's multiple modality. Like I said, it's diet, exercise, sleep, stress. But communication and stop porn, stop smoking. There's multiple things you have to do. So my mission is to really educate men and women about sexual health, because I feel that you can have sexual health for life. I have many couples in their late 80s, 89, 88, still enjoying sexual activity 3 to 5 times a week without Viagra, without Cialis, and they're in the best part of their life right now.
Wow.
So it can be
89.
done. Yeah,
We
because
have,
yeah.
whoa, sorry. I was just going to say, we have times to look forward to.
And it can be done because, like years ago, nobody can believe that a man can run a 4 minute mile. Now it's not unusual anymore. So take it from me. You can be in your 80s and still have the best sex of your life. You just have to know what to do to preserve it and optimize it. I tell my patient and my listeners on YouTube that treat treat your sexual organ, your penis and your vagina, like your teeth. You clean it every day, you floss it, you brush it, and you go to the dentist every 6 months. You should do the same thing. You take care of it, and you maintain it, and you bring blood flow to there, because we do that for our teeth, so that way we can have it to the day we die, right? The same thing for your sexual organ. You have to take care of it, because if you don't take care of it, it's not going to be ready for you when you want it, right?
Oh my gosh. Okay. Treat your sexual organ like your teeth. Brush it, floss it, bring blood flow to it. Okay. This has been so much fun, Anne. Okay, so we know where to find you. We're gonna link your YouTube channel in my show notes. Is there anything else you wanted to share with the audience before we part? And I'll see you soon on your podcast.
Yes, yes, I would love to have you on our podcast. So the main thing is that if a man or a woman, if you start to feel that your sexual response is not what it used to be, I encourage you to that's a warning sign. Okay, don't try to treat yourself. It's like, would you treat yourself if you have a heart attack? No. Go get some blood work done. I can't stress you enough that 50%, 57% of men that has ED that went to see a doctor's office are first newly diagnosed with diabetes and high blood pressure and high cholesterol, because those are silent signs that in our body, but it manifests as ED, right? So get your blood work. All right. If you're concerned about doctors are doctors, you just tell them, I'm not performing well in the bedroom like I used to. Get some blood work. These are basic steps. Insurance covers it. You get a CBC, you get a complete chemistry, get your hormones level, check testosterone, total testosterone, free testosterone, and SHBG. But the point I'm trying to make is that get your blood work done, because oftentimes when you catch it early enough and when you start noticing symptoms, you can reverse it. You can reverse it. You don't need Viagra or Cialis. We are being brainwashed. Men are being brainwashed that they need a pill for them to have an erection. Something that is so innate for them is ridiculous. All right, it's ridiculous, because you're being brainwashed and you need a pill for that. When you first have symptoms, right? Take a look back at what you're doing with your lifestyle, your diet, your exercise, sleep, and stress. If you just change one of those pillars of sexual health, you're gonna start seeing changes and improvement right away. Oftentimes within weeks. And the
Awesome.
first thing for a man is that if they have nocturnal erection or nighttime erection, that's a good sign.
Wow.
It's good as a Viagra, but we don't hear about it in mainstream media. We don't hear about CNN or Fox or anything like that, because you know why? They don't want you to know. They do not want you to know. They want you to take the medicine, because Pfizer, which make Viagra, make $9 billion a year on Viagra sales. All right. So they don't want you to know. They want you to take a medicine, because when you continue to have ED, that 67% of men actually end up having a cardiac event 7 to 10 years down the road. Yeah.
Wow. Okay.
Yeah.
Well, this is very, I've learned so much from just this past 40 minutes talking to you, Anne. Thank you so much.
Thank
This
you.
has been so helpful. And I am sure everybody who is listening is going to take away at least a couple, if not like 100 things from this episode. So thank you so much. It was such an honor to have you on.
Well, thank you for having me. And I'll look forward to having you on my podcast.
Okay, perfect. What an amazing session with Dr. Anne Truong. Oh my gosh. She left my head spinning. I seriously did not know about that stuff, about having that stuff. I did not know that making love 3 times a week will decrease your sadness, right? Like, or just being able to make love, be intimate with your partner has been clinically proven, research proven that you will have better cardiac health and longevity. I didn't know that you burn some calories, 100 calories. Okay, great. Now you can go eat that, one handful of nuts. That's great. But I mean, to decrease your risk of depression and increase your cardiac health and longevity, amazing. So if you don't use it, you lose it. Love that. Treat your sexual organ like your teeth, brush it, floss it, bring blood flow to it. She was just so funny. And, just remember, out of all this, that family comes first, right? We're all hardworking, busy physicians or high-performing professionals. Remember, family comes first. Sexual health is a priority. If you are not prioritizing it, put it on your calendar now to do so today. If you're putting dentist appointments on your calendar, you must be putting sexual health appointments on your calendar too, especially if you're around my age or a little bit older or even younger. If you started to notice that you're just not craving or your desires are not the same as they used to be. There might be a reason for that. Go get your blood levels, check your testosterone, your thyroid, all these different levels she just kind of rattled off. And I don't know because I'm a radiologist. So the other great point Dr. Anne made, is when he said, I want a divorce, she listened. She didn't listen to, I want a divorce and then comply, but she listened to him by putting herself in his shoes. She got it. She said, I get it. If I married somebody who was working Q3, never saw them ever, and when I did, they were exhausted, I would feel the same way. So reevaluate your work-life alignment. And would you want to be married to you? Do you get it? Do you get why your spouse wants to just see you? Or when they say, I want a divorce, or they're unhappy, instead of getting defensive or critical, can you listen? Can you understand? And then make it your job to figure out what your part of the story is, the situation, and then show up with love, with excitement, ready for action. That's what I've got, my loves. I hope you go and spread the word. Share this episode with anybody who needs to hear it, a man, a woman, or just a human. A human needs to hear the information by Dr. Anne Truong. So important. We don't learn all this stuff in medical school, which is why we have podcasts now to kind of spread information. Other physicians are doing great in the world. If you share this with a friend, you never know how big of an impact you might have on their life, on their marriage, on their relationship, on their children, right? Setting the tone, right? Changing the tone of sexual health from shame to empowerment. Go empower. And if you enjoyed this episode, please leave us a 5-star rating and review. So much love, my sweet friends. If you are finding the concepts I teach in these episodes useful and want more in-depth and personalized support for your relationship, consider this your invitation to join me in creating the most connected and intimate relationship with your spouse that you could dream of. Go to www.medicinemarriageandmoney.com right now and download my 18-page medical marriage survival guide and workbook at no cost to you. I also have a 6-day marriage challenge, which goes over the 6 predictors of divorce at no cost to you. These have been known to decrease fighting, rumination, and grudges between you and your loved one. If you want to take it a step farther, really enhance the joy and connection in the most intimate relationship in your life, sign up for my 8-week Making Marriage Work program today at medicinemarriageandmoney.com. Thanks for leaving us a stellar review, subscribing, and sharing with your friends on social media. You have the power to improve someone else's life and marriage simply by sharing this episode. Much love to you and your spouse. You're exactly where you need to be in this moment. Adios, my friends. The content of this episode is not intended to be a substitute for professional, medical, or financial advice. The opinions provided on this episode are those of myself or the invited guest alone. They do not represent the opinions of any particular institution. Always seek the advice of your physician or financial advisor with any questions you may have of a medical condition or financial plan. This is for your entertainment only.